It's a tough time to be an employer today. You've got supply chain issues, you've got issues trying to find good employees and then also keep them. And then, of course, there's always kind of hanging over us the cloud of the pandemic. Added to all of that is the cost of providing benefits to your employees. It's a tough time to be an employer. We just got an opportunity recently to look at a group that has 1,200 employees spread all over the United States. They're with one of the largest insurance companies here in the United States. They are doing what we call administrative services only, ASO. There's no insurance. All the insurance company is doing is administering and paying for claims for this employer. 1,200 employees, and we were asked to see how much money we could save this particular group. We didn't get much information. We got 2 renewals, we got a census, and that's really about it. But as we kind of dug into it, we were able to see red flags everywhere. The first thing that we saw was the cost for the administrative services. This particular company was charging $60 per employee per month just to administer claims. That probably included the cost of access to their network and maybe a couple of other things. But we could do the same thing and more for $27 per employee per month. We were also able to look into the actual claims. We had a claim file, and it showed that this company was spending a little over $8,000 per year for employee medical and about $3,500, almost $4,000 for prescriptions. That's $12,000 per year for claims. And we use a benchmark of $6,000 for medical and $3,000 for prescription. So again, another red flag. So we were seeing red flags, even with limited information. We went back to this employer and told them that we thought that we could save them. Their annual spend for administration and claims was roughly about $17 million. We thought we could save them at least $2 million. Kind of tied up in there was prescription rebates. We have no idea if this company is getting rebates or not. But for a company of this size, they should be getting at least $500,000, $500,000 in rebates. They have no idea. And then the kicker to all of this was right there on the top line. There was a charge for stop loss administration. There was no stop loss. $8 per employee per month for stop loss. So a lot of questions. So our promise to you as an employer is complete transparency. We will sit down with you and go line by line by line to show you what your costs are, even what you're going to be paying us. That way you can make a great decision in spite of all of these other issues that are beyond your control. Supply chain, pandemic, employees. The one thing that we believe that you can control, and we're going to help you do it, is your healthcare spend. Thanks, and we'll be back with you real soon.